Hello, Dr. Pranaya here. Today we are going to discuss few common frequently asked questions by patients regarding hair transplant. How much time does it take for hair transplant result? It depends. If I have to say in one sentence, it takes minimum of 8 months up to 18 months. So 8 to 18 months is the duration wherein we can see the complete hair growth on your scalp. So some people respond very early, 6 to 8 months they get enough hair growth, but later on some people say that once they shave the scalp it takes longer time for them to grow the hair. So such type of people, their rate of hair growth is a little longer, so they take minimum of 10 to 18 months also. Next is when to start PRP after hair transplant. After hair transplantation you can start PRP immediately as early as after 2 weeks. So after 2 weeks you can start PRP treatment, and then every month one session like that you can take the maintenance therapy to enhance the hair growth. Then nutrition improvement in hair fall, that is the question. And next is any diet or lifestyle change that will benefit the hair growth. Definitely. Hair has a lot of influence of your lifestyle as well as what food you eat. So after hair transplantation we advise you to have a balanced food so that you get enough proteins, enough vitamins, minerals and water into your diet. Good lifestyle also improves your hair growth. If you are sleeping well, if you are stress free, if your diet is very good, if you are emotionally active and stable, definitely it has an influence on your hair growth. So we ask you to take enough sleep, we ask you to have balanced food, we ask you to avoid all sort of stress and take enough rest. Then the last but not the least, can hair fall be treated by PRP alone? So PRP alone cannot be the treatment for your hair fall. Hair fall is a entity where many factors are important. So we have to count the factors that are playing role in your case. PRP is just a supportive treatment for your hair. We first have to understand why you are getting the hair fall. We have to address that first, and after that as a supportive therapy you can take PRP. PRP alone may not be the treatment of choice for any sort of hair fall, let it be baldness or let it be any sort of hair fall in females also. So you have to understand, identify the cause for your hair fall, identify the trigger for your hair fall, get it treated. Along with that treatment you can add on PRP as a therapy. Next very common question that comes is about minoxidil and PRP treatment. Minoxidil is one of the FDA approved medicine for baldness or hair loss. Even after hair transplantation we advise you to use minoxidil for a certain period of time, even longer. PRP also the same way. Platelet rich plasma is a supportive treatment for growth of your hair. After surgery, whatever hairs are implanted, minoxidil and PRP will have effect on those hair as well as your existing hair which may be progressively undergoing to baldness. That area also is taken care by minoxidil and PRP. Though it is not mandatory, but if you use minoxidil after hair transplantation and if you take PRP or mesotherapy injection after hair transplantation, it will definitely help your hair to stay and grow in a better way. Then the question is, can diet and lifestyle change benefit in hair fall? Definitely it does. If you have good lifestyle, if you are maintaining enough sleep, balanced food, stress-free life, it has definitely effect on your immunity, and so it will have effect on your skin and hair also. So if your diet is rich in all vitamins, minerals, proteins, whatever are needed for your hair growth, definitely it is helping you. If your lifestyle has certain parameters which are not good for your health and you are taking care of those parameters, like if you are not sleeping properly, your quality of sleep is bad, if you have certain emotional issues, if you are stressed about work or in personal life, all those things will have impact on your hair. So definitely a lifestyle change matters a lot in case of hair growth. Next thing is about who can do hair transplant. Is it advisable to do more than 50 age? So after 25 age anybody can do hair transplantation if they have gone bald. Up to the age of 50 we can do it. After 50, if your health condition is all fine and you have good donor area, then you can undergo hair transplantation with proper evaluation and monitoring after the surgery. Survival of the hair follicles after harvesting outside the body. That is a good question. Survival of hair follicle is very important when we are doing the hair transplantation surgery. So to keep the grafts viable, we keep them under particular temperature, and we also keep spraying normal saline or ringer lactate fluid over the grafts so that it remains viable. After the harvesting is done, within a span of 6 to 8 months, you have to implant those hair onto the scalp. So we always try to maintain proper temperature and proper environment for the grafts to be viable, and immediately we transplant those many hairs into your bald area. Next question is, after how many days of hair transplant, trimming and shaving is allowed? After surgery, there is a shedding time. After surgery, 10 to 15 days after that, shedding starts, and it remains for 3 to 4 months. So ideally for 3 to 4 months you need not trim or shave your scalp, because trimming or vibration or cutting your hair can act as a trauma to the hair, and thus it will hamper the enrooting of the graft and the growth of the hair as well. So 3 to 4 months time you should avoid trimming or cutting the hair, as well as you should also avoid massage on the scalp or use of hair wax, hair oil, or any traction, use of helmet. All these things are to be avoided. Next is, if I have high sugar, can I do hair transplant? High sugar means you are diabetic. So first and foremost you have to know whether your diabetes is under control, how is your HbA1c keeping, and before surgery, at least 1 month prior, you should get it corrected properly with medication or injection, insulin, whatever is needed. After surgery also your sugars should be under control, because impaired sugar will give rise to delayed wound healing. There will be some change into your scalp that will hamper your growth of the hair also. There is chance of severe bacterial infection or fungal infection onto the scalp because of impaired sugar level. That again will hamper the environment for the hair growth. Again, you have chance of hair thinning on longer duration, because if you are a diabetic for a particular period of time, there are certain changes that are already happening into your scalp and your body also. So as an effect of that, the hair thinning comes. So when you are doing a hair transplant surgery and you are diabetic, you have to understand that whatever inner stimulus is going to your hair from your body, if your uncontrolled sugar is there, that will hamper the hair growth even after hair transplantation is done. That is why many a times it is said that diabetics have more failure rate of hair transplant, so you have to take care accordingly. So friends, these were all common questions related to hair fall and hair transplant surgery. We'll see you again. Keep watching the channel. Thank you so much.